As we age, gravity pulls our face down, our upper eyelids become puffy, sagging, covering the field of vision in some cases. If it's excessive, sometimes we might even pull the brow up a little bit to enhance the final result, but probably 95% of patients just essentially need a little bit of excess skin, a little bit of muscle taken out, and very occasionally a little bit of fat in the upper eyelids. We make incisions through the crease line of the upper lids, so the incisions are very well hidden. Upper eyes, fabulous bang for the buck in the aging face, easily done under local anesthesia, great procedure. And then there's lower eyelid surgery. A little bit different kettle of fish, and the reason why is everyone who is aged over the age of 40 wants to have the lower eyelids that my 18-year-old has. Smooth, seamless, no wrinkles. That's not going to happen. Surgically, we can tighten the skin a little bit, but the common thing that we see as an issue is fat pads bulging along the lower eyes. And so that's why occasionally we may need to use some injectables to smooth things out. Blepharoplasty does not remove fine, tiny wrinkles around the eyes. Sometimes we may have to augment a blepharoplasty by using some Botox around the eyes to smooth out those fine, fine wrinkles, because a surgical approach will not solve those. I would say to these people, well, you might need a bleph, you might need a little bit of Botox later on the upper eyes, laterally, and in the lower eyes, you may want to fine-tune that again with a little bit of Botox on the lower eyelid and maybe some injectables to smooth out subtle irregularities. When we perform upper and lower blepharoplasty, it's critical for me to have the patient awake. Why? We need the patient to open and close their eyes while we're doing the surgery so we can judge how much skin exactly to take out. And similarly with lower blepharoplasty, we not only have to get you to open and close your eyes, but we have to get you to open and close your mouth so we can determine exactly how much skin to take out. Easily done under local, not a problem, but you want to be awake to get the best result. If you think your upper and lower eyelids are aging not in a way that you'd like to see, call Younger Facial Surgery Center. We'll assess your eyes and spell out the options for you.